Mental health is a vital component of overall well-being, influencing our emotional, psychological, and social states. However, for many years, mental health issues have carried a heavy burden of stigma, discrimination, and neglect. In this comprehensive exploration, we will scrutinize the state of mental health policies worldwide and assess whether governments are taking adequate measures to address these critical issues. Stigma surrounding mental health has been a significant barrier to seeking and receiving proper care. We will delve into the significance of addressing mental health, analyzing current policies, and discussing the actions required to alleviate the stigma associated with mental health challenges. The significance of addressing mental health cannot be overstated. It affects the quality of life for millions of individuals globally, influencing their ability to work, maintain healthy relationships, and function effectively in society. Mental health is integral to one's overall well-being, and ignoring it can lead to severe consequences, both individually and societally. The problem of stigma attached to mental health is deeply ingrained in society. Stigma often stems from misconceptions and a lack of awareness about mental health conditions. It results in prejudice, discrimination, and a reluctance to seek help, leaving individuals suffering in silence. Mental health policies play a crucial role in addressing these issues. They encompass a range of strategies and actions developed by governments to promote mental health, prevent mental disorders, and provide care and support for those affected. These policies should aim to break down barriers, reduce stigma, and improve access to mental health services. Despite the clear importance of addressing mental health and reducing stigma, not all governments have implemented effective mental health policies. It is a global issue that necessitates a coordinated and compassionate response from governments around the world. The impact of mental health on individuals and society is profound. Mental health conditions can affect anyone, regardless of age, gender, or background. They can lead to severe disability and suffering, impacting every aspect of a person's life. In severe cases, untreated mental health issues can lead to homelessness, incarceration, and even suicide. Stigma is a major impediment to mental health care. Stigmatizing attitudes can lead to discrimination in education, employment, and housing. Individuals experiencing mental health challenges may avoid seeking help due to fear of being judged or ostracized by their communities. The consequences of this stigma are far-reaching and affect not only individuals but society as a whole. Effective mental health policies are essential for addressing these challenges. They provide a framework for governments to invest in mental health services, destigmatize mental health conditions, and promote awareness and understanding. Such policies are a testament to a government's commitment to the well-being of its citizens. The World Health Organization, WHO, recognizes the global burden of mental health conditions and has called for increased attention to mental health policies and services. They emphasize the need for mental health to be integrated into the broader public health agenda, recognizing the interconnectedness of mental health with physical health, social well-being, and economic stability. Mental health policies are designed to encompass a range of components. These may include public education campaigns to raise awareness and reduce stigma, funding for mental health services, research to improve our understanding of mental health conditions, and strategies to prevent mental disorders. These policies aim to provide a holistic approach to mental health that extends beyond treatment to prevention and promotion of well-being. Efforts to reduce stigma surrounding mental health are a fundamental aspect of effective mental health policies. Stigma can manifest in various ways, from negative stereotypes and discriminatory behavior to self-stigmatization, where individuals internalize the negative beliefs associated with mental health conditions. By addressing stigma, policies aim to create an environment where individuals are more comfortable seeking help and where they face less discrimination when they do. The state of mental health policies varies widely from country to country. Some nations have made significant strides in developing comprehensive mental health policies that promote awareness, provide services, and reduce stigma. Others, however, lag behind, leaving their populations without the necessary support. In more developed countries, mental health policies often include the establishment of mental health care systems that offer a range of services, from counseling and therapy to medication and hospitalization when needed. These policies emphasize early intervention and support for individuals experiencing mental health challenges. They also promote the integration of mental health care with general health care to ensure that mental health is not neglected. The role of government leadership in developing and implementing mental health policies is pivotal. Governments have the capacity to allocate resources, enact laws, and set priorities that influence mental health care. Effective policies require collaboration across various sectors, including health, education, employment, and social services. In less developed countries, mental health care is often underfunded and lacking in resources. The stigma attached to mental health can be particularly pronounced in these regions, compounding the challenges individuals face when seeking help. Despite the variations in mental health policies worldwide, there is a growing recognition of the need to prioritize mental health. The global burden of mental health conditions is substantial, and the economic and social consequences of ignoring mental health are evident. Stigma reduction is a key component of mental health policies. Public awareness campaigns, educational initiatives, and the portrayal of mental health in the media all play a role in challenging stigmatizing beliefs and attitudes. When individuals are more informed about mental health, they are less likely to perpetuate stereotypes and more likely to offer support to those in need. Governments should also ensure that mental health care services are accessible and affordable. Financial barriers can deter individuals from seeking treatment, and mental health policies should strive to make care available to all, regardless of their financial circumstances. The question of whether governments are doing enough to address mental health and reduce stigma remains a contentious one. The effectiveness of mental health policies can be difficult to assess, and progress may be slow. Critics argue that more resources should be allocated to mental health care, that stigma reduction efforts need to be more robust, and that mental health should receive greater attention in public health agendas. In many countries, mental health services are overwhelmed, and individuals may face long waiting times to receive treatment. This delay can exacerbate mental health conditions and result in negative outcomes for those in need. The state of mental health policies and stigma reduction is also influenced by cultural and societal factors. Some cultures may be more accepting of mental health challenges and offer strong support, while others may be less understanding and perpetuate stigma. The economic impact of mental health conditions is substantial. Untreated mental health issues can lead to reduced productivity, increased absenteeism from work, and a higher risk of unemployment. Employers are increasingly recognizing the importance of addressing mental health in the workplace, and some are implementing mental health programs to support their employees. Furthermore, the criminal justice system often intersects with mental health challenges. Many individuals with mental health conditions end up in the criminal justice system, often due to a lack of appropriate mental health care and support. This can lead to a cycle of incarceration and recidivism. Youth mental health is another critical area that requires attention. Adolescence is a time when many mental health conditions first manifest, and addressing these issues early can have a significant impact on an individual's life trajectory. Schools and educational institutions can play a crucial role in identifying and addressing mental health challenges in young people. The global COVID-19 pandemic has also highlighted the importance of mental health. The pandemic has resulted in increased stress, anxiety, and depression for many individuals, leading to a growing demand for mental health services. Governments have had to adapt their mental health policies to address the unique challenges posed by the pandemic. One aspect of government action to address mental health is legislation. Laws that protect the rights of individuals with mental health conditions and ensure their access to care are essential. These laws can prevent discrimination and promote inclusion. Another essential component is investment in mental health services. Funding for mental health care is necessary to provide a range of services, from crisis intervention and counseling to medication and hospitalization. Governments must allocate resources to ensure that individuals can access the care they need. Public awareness campaigns are a means of reducing stigma and promoting understanding. These campaigns aim to challenge stereotypes and encourage individuals to seek help when needed. The portrayal of mental health in the media and popular culture is also a crucial factor in shaping public perceptions. Addressing suicide prevention is another vital aspect of mental health policies. Suicide is a tragic outcome of untreated mental health conditions, and governments should implement strategies to identify and support individuals at risk. The role of mental health professionals is instrumental in the implementation of mental health policies. The training and support of mental health professionals are essential to providing high-quality care. Governments must also ensure that there are an adequate number of mental health professionals to meet the demand for services. The availability of crisis intervention services is a critical part of mental health care. Individuals in crisis need immediate support, and governments should provide hotlines and crisis centers to offer assistance. The integration of mental health care with general health care is a strategy that promotes a holistic approach to well-being. Mental health conditions are often interconnected with physical health, and addressing both aspects is vital to overall health. Prevention programs are a key element of mental health policies. These programs aim to identify risk factors and provide support and education to prevent the development of mental health conditions. Prevention can be particularly effective in youth mental health. It is essential for governments to engage with the community in the development and implementation of mental health policies. Community input can ensure that policies are responsive to the needs of the population and that they effectively reduce stigma. The collaboration of government agencies is also vital. Mental health policies should be integrated across various government sectors, including health, education, employment, and social services. This multidisciplinary approach is essential for addressing the complex challenges of mental health. In summary, addressing mental health policies and reducing stigma is a multifaceted challenge. Governments play a crucial role in promoting mental health, providing care, and reducing stigma through policies and actions. The state of mental health policies varies from country to country, and there is ongoing debate about whether governments are doing enough to address these issues. The economic, societal, and individual impact of mental health is substantial, and the need for comprehensive mental health policies is clear. These policies encompass a range of strategies, from prevention and promotion to care and support, and they aim to break down barriers, reduce stigma, and improve access to mental health services. The effectiveness of these policies can be difficult to assess, and progress may be slow. Critics argue that more resources should be allocated to mental health care, that stigma reduction efforts need to be more robust, and that mental health should receive greater attention in public health agendas. As the world grapples with the ongoing challenges of mental health, governments have a pivotal role to play in shaping the future of mental health policies and reducing the stigma surrounding mental health. The well-being of individuals and society as a whole depends on these crucial efforts.